Hi guys, my name is Jessica. I am the Hoofstock Manager here at Out of Africa Wildlife Park. On October 15th, our park underwent a full immobilization procedure on Pilgrim, our 23-year-old male giraffe, for the betterment of his hoof care. Up until this point, we have been doing what we call semi-voluntary hoof trims on him. We have a medical tamer, otherwise known as a medical squeeze, which is essentially a metal stall with a whole bunch of padding in it that he voluntarily or chooses to go in, walks into it for us, and allows us to close that door. By bringing him into that smaller stall area, we are able to then give him what we call standing sedations, kind of a light sedative to calm him down and allow us to manipulate his feet. Now, we do have a couple other giraffes that live here at our facility that are full voluntary when it comes to their hoof trims, which essentially means they walk into an area for us, pick up whatever foot that we ask onto a block, and allow us to just give them their trims. But over the years, Pilgrim has made it very evident that he just does not like his feet touched. So by doing the standing sedations and the tamer, it has deemed just the best process for him. Now, we have been doing hoof trims on him every about 4 to 6 months. We do bring out our specialized farrier team to the zoo hoofstock trim program that come from their Colorado base that do fly out for him regularly to work on his feet. We did have a procedure scheduled back in May, and unfortunately, for whatever reason, Pilgrim just decided that he was not going to go fully into his tamer that day. After about 2.5 hours of us coaxing, pleading, unfortunately, we just were unsuccessful in convincing him all the way through. So the decision was made to then reschedule for another month out. Now, per usual, we continued with our daily training sessions, bringing part of his diet in, his lettuce and treats, and trying to convince him to go all the way through, just putting him through those motions. But unfortunately, every day leading up to that rescheduled appointment, we were unsuccessful. So 2 days before our farrier team were planning on coming out, we did have to cancel it. Now, with that leading up, we were now months after his scheduled procedure. We knew that we did have to change our course of action and decide what was going to be the best plan to help give Pilgrim his hoof trim. With that being said, hoof care is vital in the husbandry protocols and care practices when it comes to giraffe and really any hoof stock. Just like us, your foot health is everything. If you have unhealthy feet, it makes living really painful. It makes it hard and difficult. And when it comes to our animals that do have hooves, anytime that their hoof does overgrow, it changes the angle of the internal structures of their feet, including their toe bones. It does cause them to essentially walk on angles that they're not meant to. And when you do have an animal such as Pilgrim, who is nearly 3,000 pounds, that difference just becomes magnified, and it can cause fractures, it can cause abscesses. Couple that with his age. He is 23 years of age, like I did mention, which is 7 years beyond the median life expectancy of male giraffe in zoos. You have other issues and complications such as arthritis that does take play. Now, he does have arthritis. We have monitored his arthritis every 4-6 months. We've taken regular x-rays to keep up with the progress of it, and he has been under a pain management protocol through our veterinarian. But when you have an aged animal like that in their geriatric life stage, just like us people, you have arthritis, you have other factors, you just don't want to move as much, you're not as mobile, and unfortunately that does play a big part in the increased amount of hoof growth that he does experience when he's not utilizing his 23-acre habitat as much as what he did when he was younger. He's not naturally chipping away at that foot, so that overgrowth just becomes increased. All of those factors coupled together did lead up to the urgency under us, or the pressures of us having to come to a decision pretty quickly on what we were going to do to care for him. After several, and I mean several conversations between the ownership of the park, my department, our veterinary staff, as well as our farrier staff, it was pretty evident that we had to proceed with what we call an infield full immobilization. So instead of now bringing him into his little foam safe box, and lightly sedating him, we now were looking at putting him fully under general anesthesia. Now, putting sedating animals under general anesthesia is common practice. We do that with a lot of the other animals that live here at the park. But when you take an animal of their sheer size, like Pilgrim, who's 3,000 pounds, you have extra complications that do play into it. One of them being both the induction and the recovery process. When you have an animal of that weight that does fall to the ground, they can crash through bushes, they can hit fences. You worry about injury, fractures, things like that to their legs, their necks. But on top of that, with their unique anatomy, their size, the length of their neck, you have a lot of respiratory issues when it comes to giraffe, and it is very common for them to stop breathing under anesthesia. So as you can imagine, there was a lot of planning that went into this, and it was not taken lightly. Choosing to do a full immobilization on a giraffe is not our first mode of method. I have experienced a couple previously, and unfortunately in both instances, with our late giraffe being one of them, Kibo, where we had to do an immobilization on him in 2019, they were unsuccessful in the recovery process of both giraffes. So all of this was weighing heavily on me and weighing heavily on the ownership here at the park and our vet team and our farrier team. But after several conversations, we did know that this ultimately was going to be the best chance to give Pilgrim what he needs to be able to live out his geriatric life as pain-free as possible. Because of the overgrowth and the pain that he was exhibiting, we knew that it was important to try to give him the biggest reset that we possibly can, bring his foot 100% back to where it should be, as well as be able to perform a geriatric exam, getting our hands on him to do dental work, be able to do blood work, be able to do x-rays and any other type of diagnostic care that we could get on him to aid him in living as long as possible that he can. As I did mention before, the planning process for this immobilization was not an easy feat. First of all, you do need several veterinary teams just to pull this off and make it successful. We, after several conversations, made the decision to bring in Dr. Dodone through the Giraffe Veterinary Services. She is an expert when it comes to giraffe care and has the most experience with giraffe immobilization, in my opinion. So the decision was made to bring her out and make her kind of our primary vet leading this procedure. Now, she also brought out a really good colleague of hers, Dr. Wood, through the Roosevelt Park Zoo, and together they led the team of what we call the breathing team, the respiratory team. So they monitored the breathing, they monitored his head, his heart rate, and all the supportive drugs that he required. Now, we also had our resident vets, Dr. Skinner, Dr. Chambers, and Dr. Taylor came in from Prescott Animal Hospital, as well as some of their vet techs and their vet students that were shadowing them. And they led all the diagnostics, the blood draws, they helped run the dental work, the x-rays, etc. Now, on top of that, on top of our massive vet team, we also had our farrier staff, like I said, Steve Foxworth through the Zoo Hoofstock Trim program, as some of his farriers did come. That way we could have multiple farriers working on multiple feet at once. And then, because I didn't mention the sheer size of Pilgrim, his weight, animals don't always sedate in the perfect spot where you want them to go. So we did have to plan for every case scenario, good cases, bad cases, the worst cases. And so we ended up bringing out Soleil Dulce, who runs the Arizona Equine Rescue Organization. And her, as well as 4 ropes experts through Scottsdale Fire Department, did come out, and that way they could help us manipulate him in any case scenario, whether it be moving him to a better area or helping him out of a sticky situation if he went down in the middle of a whole bunch of bushes or trees. And in case of emergency, if we did need to lift him, because of his size again and because of his weight, we did bring out DNO cranes, who is actually local to Cottonwood, and they were on standby with a massive crane so that way we could lift him if need be. several months of planning did lead up to the morning of, and all of our teams met up for the very first time here at the park. We did make the decision because of the sensitivity of this procedure and not knowing how long Pilgrim was going to need to recover and not knowing where the procedure exactly was going to happen in the habitat. We did make the decision to shut down the park for a day, and our team rallied early in the morning. One of the scariest portions of a giraffe immobilization is the induction on them. A lot of animals, when you do sedate them, they get a little sleepy, get a little groggy, they lay down, they curl up in a ball, they feel funny, and then they lay down, they sleep. But when it comes to giraffe, they're stubborn and they fight it until it hits them, and then it hits them hard. That was not the case with Pilgrim. It could not have gone any more perfect. Our sweet little angel old man decided to just lay down to his knees. He slid down a little hill into the soft sand of our wash, and then he laid down sternal for us. At that point, the troops were called in, and our massive team of over 30 people rallied. And as quick as we came in, everyone just jumped straight to their tasks. With the planning process that was just made that morning, everyone knew what role they had. Everyone was there just for the love that we had for Pilgrim, and we all got the work done. Within seconds, our farriers each had a foot and were going to town. Our vet team was putting a trach tube in so that way they could set him on oxygen and breathe for him. He had fluids put in, supported drugs put in, x-rays were being hooked up. A shade structure was being put over him so that way we could control his body temperature. And within an hour, everything was done. Now, while we also were doing his feet, as I did mention, we were also focused on a dental exam. Being that of his age, we just wanted to make sure that everything was healthy and that he didn't have any diseased roots in his mouth, and everything looked fantastic. And I can happy to report our veterinarians were very impressed with his body condition, especially for the age that he is at. At this point, it was time to start waking him up. So as quick as everyone flooded into the habitat, everyone left. Everyone grabbed equipment, threw them in trucks, and started leaving the habitat, leaving just the primary people that were there during the induction, with the exception of some of our ropes team. We wanted to have them on hand just in case, as he was getting up, again, he got himself stuck into a weird situation. And it just became another waiting game. We stayed quietly. The rest of our team went to the outside of the habitat and all watched from the other side of a fence. And we were all mostly just holding our breaths, just waiting for him to wake up. Within about 15 minutes, he started stirring. He started picking up his head. He did make a very valiant effort to try to stand. He rolled up. Our farrier team with Steve and our veterinarian team and our ropes team were all behind his neck, pushing him as hard as they could. But unfortunately, he was not ready yet on that first attempt. He rolled back down, and our team was just able to kind of guide his head back down to the ground. He took about maybe another 4 or 5 minutes, gave it one more effort, and on this final push, he did stand up. To tell you the amount of cheering and hollering that we had in the park was pretty amazing, especially given, like I mentioned, our previous experience with Kibo back in 2019. At that point, it just became grand effort. Everyone hugged, everyone cried. He walked away. We monitored him at that point every 30 minutes for the rest of the day. And then through the night, myself and my assistant manager, Armando, did end up spending the night here at the park. And we did check on him every 4 hours. And I can very much happily report that he is now 100% back to his normal state. I just really want to thank you guys as our supporters, as our guests, as our followers, for all the love and support that you guys have poured into us during this time with Pilgrim. My department, especially the owners here at the park, we have really felt the support, and having that behind us really did help validate all of our efforts that we do for our animals and all the decisions that we do have to make. Without your prayers, without your kind words, without your support, we would not be able to do what we do here for our animals, for these gorgeous animals that we do call our family. So thank you again. We really do appreciate you, and I know Pilgrim does as well.